How does body temperature affect toxicant metabolism? Enzyme activity is temperature dependent. Hypothermia, for example, during anesthesia or neonatal care, slows hepatic metabolism and renal clearance, prolonging half-life. Conversely, hypothermia can increase metabolic rates but also risk enzyme denaturation. In reptiles, for example, being ectothermic, cold environments dramatically slow detoxification, making even small doses of anesthetics or insecticides dangerous. What role does fecal excretion play in toxicant elimination? Fecal excretion occurs via direct gut elimination, biliary secretion, or unabsorbed oral doses. Large, non-polar compounds, like ivermectin or macrolide antibiotics, are excreted this way. Feces can contaminate the environment, leading to re-exposure or harm to coprophagic species. This route is especially important in evaluating environmental impact of antiparasitic drugs in livestock. How do food and feeding schedules affect oral toxicant absorption? Food delays gastric emptying and may bind or solubilize toxicants. For instance, milk binds some metals like lead or iron, reducing absorption. On the other hand, a high-fat meal may enhance absorption of lipophilic substances, like vitamin D or permethrin. In clinical settings, fasting before exposure may increase vulnerability to oral toxicants due to faster GI transit. What is the loading dose concept in toxicology? A loading dose is a higher initial dose to rapidly achieve therapeutic, or toxic, plasma levels, calculated using volume of distribution, VD. In accidental poisonings, the concept helps estimate how much toxin entered the system. For instance, if a horse consumes a bolus of phenylbutazone, the loading dose can be estimated to predict severity and plan fluid or charcoal therapy accordingly. How does mucosal integrity affect toxicant absorption? Damage to oral, nasal, gut, or rectal mucosa enhances permeability, allowing more toxicant into circulation. For example, a calf with rumen acidosis may absorb more nitrate due to mucosal injury. Similarly, ulcerated oral mucosa in cats can increase toxicity risk of hydrogen peroxide or topical agents. Maintaining mucosal health helps reduce systemic toxicant exposure from local irritants. What are the challenges of modeling toxicokinetics in wildlife species? Wildlife species vary widely in metabolism, diet, behavior, and environment. Data on organ weights, blood flow, or enzyme activity is often lacking. For example, modeling lead toxicity in vultures requires assumptions based on related birds, which may not reflect actual kinetics. Field variability, for example, migratory patterns, seasonal changes, further complicates prediction. Still, PBPK and TKPD models are being adapted for conservation toxicology. How do bile flow and enterohepatic circulation influence toxicity? Compounds excreted in bile, for example, NSAIDs, chloramphenicol, can re-enter the intestine, be reabsorbed, and prolong systemic presence. Reduced bile flow, as in liver disease, hampers this process, possibly altering toxicity profiles. Conversely, hyperactive enterohepatic cycling increases risk of accumulation. Repeated charcoal dosing interrupts this loop, especially for drugs like carbamazepine or phenobarbital in small animals. How is total body clearance used in toxicokinetic equations? Total body clearance, CL, is a composite parameter reflecting the body's ability to eliminate a toxin via all routes. It's used in formulas like half-life equals 0.693 VDCL. This calculation helps predict how long a toxicant will persist and how rapidly detox efforts will work. In renal failure, for example, CL drops, prolonging half-life of renally excreted drugs like aminoglycosides or ethylene glycol. What is the importance of mass balance equations in PBPK models? Mass balance equations ensure that the amount of toxicant entering, residing in, and leaving each compartment is accurately represented. This forms the mathematical backbone of PBPK models. For instance, in a model of pesticide exposure in pigs, the liver mass balance equation accounts for arterial input, venous output, metabolism, and biliary excretion, allowing realistic prediction of liver residue levels and withdrawal periods. How can toxicokinetics aid in environmental risk assessment, ERA? Toxicokinetic data help predict bioaccumulation, persistence, and trophic transfer of chemicals in ecosystems. For example, if a pesticide is lipophilic with a long half-life, it may persist in fish fat and enter food chains. Modeling these dynamics supports regulatory decisions on pesticide approval, effluent limits, or feed contaminant thresholds. ERA depends on accurate modeling not just in animals, but across ecological interfaces.